150 hospice patients who could end up with nowhere to live. Word coming down, Medicaid payments for these low-income patients are being suspended by the state. That's because their hospice program is under investigation. Our Jacqueline Iglesias is taking action, going to the CEO of the hospice company looking for answers. Jacqueline?
Well, Jameson, patients of Hospice of Citrus in the Nature Coast, along with their families, were notified of the possibility they could get kicked out last week. But the CEO promises he's taking care of these dying clients.
It's kind of like dad comes home, has a lousy day, but the kids don't know it because he's playing with the kids.
It's the analogy the CEO of Hospice of Citrus and the Nature Coast thinks is most comparable to his company's current situation. They're under federal investigation, and 148 of their low-income hospice patients have had their Medicaid payments suspended as a result, meaning the money to pay for their end-of-days room and board is gone.
We're not doing anything wrong. We're serving dying people here.
The facility began facing a federal audit 15 months ago, leading to a dispute over record keeping.
Clerical mistakes, documentation that the government says doesn't fit with the services rendered to the patient. We disputed some of those.
In an exclusive sit-down with ABC Action News, CEO Anthony Palumbo claimed nothing criminal took place. However, the federal government is calling their investigation criminal, leading the Florida Agency for Healthcare Administration, which funnels the Medicaid payments, to suspend them in July. The state says if the providers make the decision to stop serving recipients, it will work with those patients to avoid disruption in care. With one nursing home cutting ties with Palumbo's business, several patients are now working with the state. But Palumbo says he's taking care of the remaining patients using his charitable organization's funds to keep them in the hospice program.
I'm not sure what per patient, but on a monthly basis, you're probably looking at about $800,000.
A bill his facility has footed twice. And he said with funds running out, he has no choice but to reach a settlement agreement with the government. But he's not admitting any guilt.
At the end of the day, we just want to move forward beyond this, and that's why our level of cooperation has been from the get.
According to Palumbo, if his facility can reach a settlement agreement, he can retroactively bill Medicaid for the money he put out to cover those 148 patients. The hope is to settle this within a few weeks, but if that does not happen, Palumbo does not have the funds to keep these patients in hospice. Reporting live in the studio, I'm Jacqueline Iglesias.